Adolescents transition from childhood to adulthood. Emotional, cognitive, and social factors define their stage. Given their level of need and the number of unanswered questions regarding healthy behavior, adolescents are underutilizing current healthcare systems. This is due to several factors, including cost, scheduling, and concerns about confidentiality. There's therefore the need to invest in the health and socio-economic development of the growing number of adolescents and young people in the country today. The Ghana Adolescent Reproductive Health GHARH project sought to address this need. The project commenced in December 2013 in the Brong-Ahafo region with funding support from UK Aid through the Palladium Group.
The GHARH project is financed by DFID, Ghana. There's support from the British government to the government and people of Ghana. The project was conceptualized out of the then effort of the Ministry of Health, Ghana Health Service, to improve maternal health services and thereby improve maternal health outcome, mainly around family planning, mainly around reducing maternal deaths and improving access to health services, including family planning services. The subcomponent is the adolescent component that the project is focused on. So that was essentially the motivation, and there have been also policy documents on developed by both the National Population Council and the Ghana Health Service that adolescent pregnancy and early childbearing is indeed a big burden in Ghana, and therefore they wanted to do something about it. So that was the motivation, essentially, to help reduce adolescent pregnancy and improve access to health services for maternal and family planning services.
Hope for Future Generations, HFFG, a women, children and young people focused Ghanaian-based organization, partnered Palladium to implement the GHARH project in 9 districts in the Brong-Ahafo region. Due to its countless achievements in this region, the project was extended to the Ashanti region in October 2016. The project goal was therefore to contribute to 6% reduction in teenage pregnancies in Kumasi Metro, Atrima Kwauma, and the Asokore-Mampong district by July 2017.
The GHARH project was designed to empower young people to take charge of their sexual reproductive health rights and also have information and the knowledge that will empower them in decision-making, negotiation skills, and also to make them grow up to become very useful citizens. Because we work as a team, we've been able to reach young people in the region with information, knowledge, and education that has really helped them to be informed about their sexual reproductive health rights.
HFFG implemented the Ghana Adolescent Reproductive Health Project in partnership with key community stakeholders such as the Ghana Health Service, Ghana Education Service, Planned Parenthood Association of Ghana, Queen Mothers, parents, and most importantly, adolescents, with the National Population Council playing a coordination role.
I must say that all the partners have done very well. I start from Ghana Health Service. Ghana Health Service, most of the challenges were on our neck. And we had the hope that we have people who are coming to help, so we gave it all out to cooperate and do our best. Then the individual partners also did their best. Hope for Future Generation, talk about PPAG. And then Ghana Education Service, even though we are doing health education, school health, but it was not so much. But once the program also came in, the project came in, they also activated them. And then the school coordinators, the schools involved, and the coordinators and the SHEP coordinators were very active. In fact, all the 3 districts, you could see that the collaboration was very excellent.
HFFG adopted several strategies such as capacity building of peer educators and advocates, community outreach, to reach hundreds of young people with information about their reproductive health and solicit information from them. counseling sessions, skills training, creating referral systems, among others, to respond actively to the sexual and reproductive health needs of adolescents and young people in the selected district in the Ashanti region. The Ghana Health Service was a key partner in implementing these strategies.
We've chalked a lot of successes. I mean, you know, Ghana Health Service is a service provider. So our job, as far as GHARH project is concerned, is to provide services. And before you can provide the services, your service providers must be trained. They need to know what goes into adolescent sexual reproductive health. Before GHARH, we only had 10 people trained in Ashanti as the Ashanti regional team for adolescent sexual reproductive health. When GHARH came in, we were able to train 40 focal persons, district focal persons. And after training the 40 focal persons, we were able to train over 235 service providers who are on the job. And these service providers include community health nurses, midwives, physician assistants, doctors.
We come to their level. And even when the programs are addressing and everything, it's like an adolescent. We talk like adolescents. And we explain things to them the way they will understand at their level. So at times, we even go to SSS when we have to mix with Chi or the Ashanti language. When you have given or discussed reducing adolescent pregnancy, and at times the changes that adolescents go through with them, the kind of questions they come up with. And even those who cannot ask the questions right, and you read, and there is excitement, and you give them the answers, and they really appreciate what you are saying. I think that was exciting for me.
Over 30 peer educators were trained in the concept of peer education, sexually transmitted infections, and how they can be prevented, communication, gender and gender-based violence, and adolescent sexual and reproductive health and rights, among other relevant topics. The trained peer educators have been very instrumental in reaching the over 7,000 young people HFFG has reached throughout the implementation of the project. They also played a key role in bridging the gap between young people and their accessibility to SRH information and services by referring their peers to health facilities.
Some of our peer educators referred some of the adolescent girls to us. They gave them forms. So when they are coming, they send the forms to us, which was filled by peer educators. Some come for information. Some also come for family planning services. Some also come for antenatal, those who are pregnant. And those who don't understand anything about their reproductive issues, we discuss with them.
A key target for Hope for Future Generations is adolescent and young female headquarters, popularly known as KAYE, were also trained as peer educators.
Hope for Future term as peer educated. They taught me to know adolescent reproductive health and tell me to talk to my peers how to protect themselves from getting teenage pregnancy, or it helped them to prevent from STI, sexual transmitted diseases.
Peter is a 21-year-old father. He was unable to complete his education and so was at home with no form of livelihood until he became a peer educator and also benefited from the skills building session dubbed Boys Time.
Community school, Konongo Dumasi, SHS. Nami TV, Nami Nyeshe. Na abra mi tifi no by mistakenly me no baby kofa nyinsen ama akoba ne senti na me na on the sermon se manyam ma bra bob ase be basa be no so ma ampa ba nse edi ani pa na me wo no ti na ko se akoba ne se me ne ewo na me hwa akra no ti abra me ne wo wie no na nkofei bai so me training me as a peer educator na me training me fanti team see abra training me as a peer educator na Omo cheche kwan fa so atumi na mfa no mfo. Enam ade a esi wo me life ni nti e ma me tumi na mfa no mfo. Se bia bia omo so nkosa ate bia ni mu. Omo sa be che nsan dwuma. Ti se de we esi be no toma. Ene mpaboa ene ayi no. No mo sa so kra e ma me na nko se menyen. O ma ma ba ne be ma. Esa so bo cage ma me. Aye no. I'm saying no, so I'm cross some who are and so meeting be careful. And I share many acronym.
Paulina is a peer educator and advocate under the project.
I was trained as a peer educator through the GHARH project funded by the Palladium. I wasn't able to speak in public, but when I became an advocate, I've been able to speak in public, and I've been able to demonstrate how to use condoms for GHARH protection.
With the project, when it started, we knew we would definitely reduce the number of adolescent pregnancies we're having, and then we wanted to really tackle the out-of-school group. And based on that, we had services rendered on outreach basis with some of our partners like Hope for Future Generation, Ghana Education Service, and aside that, we went to schools, and then there were school class formed by GES, and then we gave the technical support to these school clubs.
87 young people were trained in making slippers, bracelets, and necklaces with beads, liquid soap making, and rabbit rearing. Among the bead makers were males, some of who are mocked by their community members because bead making is a role usually taken up by girls and women. Kwame Meno is one of them.
Me papa wo ma 5, me na me toso 3. Me go school. Me 2016 GHS. Me school no na me nye adwuma bia. Na me na mo sa ade achi a me kwa ha na me fa. Ntem me na mu ana me te se HFFG for the program be aba ema bru. Timete ye no na me say me kobi. Na me so makwa akope bibi de asimani so. Na da achi aboa me. Time koye no me hu ne ma me ensa. Me hu liquid soap. Ana me hu adanko. Ana me hu the way I was sitting pabo ayi toma agum pabo aso. Nti the o chem ni busa me say emu den na me pe. Ana me say me feel empabo no e chen the aka no. And I'm say me ye be man nti. Amam force me say me de toma ayem pabo na nso en ha me. Me say that me de bibi estimate so. Na obi fa den sa en chenchem so say abema we na akoya wokoi on pebre ana say yenka say me yekromfo nti na mani akoso a me yesa ade no ebi kwa na ma yekuta me ade bi nso na da me say mani je say hope for ade ma fa sa antiti ewem nti me nam sa akonya we so eda omase say omode ba me community mu a so manya bi aye mitiminya bi kakrade boaboa me.
20-year-old Beatrice and 19-year-old GHARH live in Yoneso No. 1, a small farming community in the Ashanti region. They both have 2 children and got pregnant when they were young adolescents. They were beneficiaries of the skills building sessions dubbed Girls' Time.
Ejumeko enidasofo omu frɛ omu yene ayawo ene apemfo a yene adwumaye so mo be kire adwuma ama yenso so yenye adwuma ede ahweyema adwuma ye de ahweyema ampa omu be kire omu be fa ye ko tebuom ekwo kire yesua ntoma ede mpaboa ene eye ena yesua reku soap Ena yesua sibia esimi ye and adanko.
Omo kyerɛ me sɛ na esi yɛ mpaboa a de tomaguso. Me do ma se mama manya bi. E de hwɛ me ne me ma. Me do ma se.
Janet, a trained peer educator and advocate, was the lead facilitator for the skills building session. She also has her own successes to share.
I was trained as a peer educator by Hope for Future Generations, and I stayed an advocate. But through the training, I've experienced many things since I came out. I've known how to talk in public. That's something that I've experienced that is good for my own self. Before I can't go out to talk with my peers, but now I'm okay.
Traditional leaders, especially Queen mothers, were a key stakeholder and strong pillar in the success of the project.
The advocate training no mo koye no. Omo baaye no me hu nsesaye. Kire se omo wo ho a omo timi hia. No mo a se weekend a wan ko school no. No mo rewura fie mu. No mo kasa kire omo afefo nkwadaa na wo ho no. E wo ho a omo timi boa omo ho ano se enne yebekọ community we ade achi and the following week yebekọ community we. Nti aboa nkwadaa na bebre. Se omo ankwa ama na nka bia omo nnim se bio wonu bra sese one be ma da no nko munnim ade kro no kra na nso mo ko sa pre-education bae no advocate pre-education bae aboa mu bebre wo kwan bebre so
Mefa akwanya we so ada UK aban ana anida soofo ana se palladium fo ase me do mo se adwuma ko nyina ase se o maye yamwa ame yenye adwuma aye
me da HFFG ene palladium na UK aid me do ma se o ma boa me amanya nsa no adwuma.
Peer educated helped me to stand in public. I don't feel same with my colleagues again.
The peer education, the advocacy, and the skilled work has really impacted positively on me.
And